Hello, you're welcome to my channel today. If this is your first time of joining us, you're highly welcome. And if you've been following us in different videos, thank you very much. And I want to thank those who have subscribed to our videos. So if you haven't, this is a good time to subscribe, okay? Today, we're going to talk about the different stages of United Kingdom Public Health Specialty Training application. There are 3 stages to the application, but today we're going to concentrate on the first stage. In our subsequent videos, we'll talk about the second stage and the third stage. So this will be a series, and the first series is just the one we're doing now. So sit back and watch. In the United Kingdom public health specialty training, it's available to both doctors and non-doctors. So when I mean non-doctors, I mean other professionals. So you can even be a doctor, but you're not yet GMC registered. You could still go into training in public health. So you don't have to have had your GMC registration to go into public health training. I can't overemphasize on this because I've had a lot of people who are asking me, do I need to have written my PLAB 1 or 2? Do I need to have registered with GMC to be able to apply? So the answer is actually no. And so there is the medical and the non-medical routes, which are equally good to apply through. So when you apply and finally get into the training, it doesn't really matter which route that you came in through, because you receive exactly the same form of training over the period of 5 years or so, depending on how fast you are in completing your competencies. Okay, so there are certain things you need to do to make yourself stand out in the application stage. You know that the public health specialty training is highly competitive. I cannot overstate that. It's highly competitive. Take, for instance, where you have just about 60 to 90 slots and you've got over 1,000 persons who are competing for it. How more competitive can it get? So it's almost like 1 in 10 ratio, which you need to do all your best to make sure that you appear very competitive and to be selected for the next stage. So what happens in the first stage is just about the application process, application itself. So you're expected to apply through the website called Oriel. Oriel is the website where every specialty training application is done. So it doesn't matter if it is public health, if it is cardiology, if it is surgery, every application is managed through Oriel. And for public health, it's once a year that is done. You could find other specialties where training can be done more than once a year, twice or so. But in public health, you just get it once a year. And so that means that you need to put out your best foot whenever the application cycle opens, so that you don't have to wait for the next year to apply again. Okay. I hope you're getting what I'm saying. Yeah. So in the application, you have set up your Oriel account. So they will ask you for details like your name, email address, and a number of things just to be able to tailor your application or information they give back to you through emails very well. So when it is time for the application to start, the Oriel portal will open for public health. Remember, we're talking about public health here. The Oriel portal will open and you are able to fill in the form that is required of you, just to get your CV basically, and your evidence, what you have said you've done before, your previous place of work, your educational qualification, and a number of other things. But here I'm going to make a distinction between those who are going to apply through the doctor's route and those who are applying through the non-medical route. For the doctor's route, it's pretty straightforward. because all you need is to have been registered with GMC, your full registration with GMC, and provision of your CREST form. CREST form is Certificate of Readiness to Enter Specialty Training. So that's basically a consultant or your manager signing off that you have done the basic things you're supposed to do as a post-foundation fellow. So if you trained in the United Kingdom, your foundation certificate is enough to get you ready for that. But for those of us who trained abroad, you need to provide that CREST form. That CREST form is essential for you to actually apply for public health specialty training. Remember, this is for those who want to go through the doctor's route. If you are able to provide this, then you're guaranteed that you'll be shortlisted for the assessment center. So that is for the doctor's route. But for the non-medical route, which is for every other person, whether you're a nurse, you're a pharmacist, you're coming from even non-health background, there are some of my colleagues who are literally in their background, they did something non-related to health, but now they are actually in public health doing their training now. So it's possible for you to really come into public health, even if you haven't done anything health related in your undergrads or postgrad. You know, in public health, we need everybody. Everybody is needed. We need your quantitative skills. We need your analytical skills. We need your qualitative skills. So we need your communication skills in public health. Therefore, we the specialty is open to every skill, because public health really, it's about everything we do in life, and there's no point restricting that to only health workers or medical people. So but there is a caveat to that. If you're going through the non-medical route, you need to write some blurbs, you need to write some things to justify that you've done things relating to public health, really. So you don't just supply that I'm interested to apply, and at the end of the day, you're giving that opportunity. Yeah, in the eligibility criteria, it is stated that you should have had at least 48 months. That's 48 months is 4 years of public health experience or population health related experience for 8 months prior to the application period. And out of the 48 months, you need 24 months, that's 2 years of that experience to be in band 6 rather, I'm sorry, band 6. So in the United Kingdom, jobs are given based on banding, and it is your duty actually to think about what a band 6 means. The interpretation is subject and open. So you could be working in any country, and you need to justify during your application that yes, so the level I was working, the role I was working is equal to band 6 and above. So your application is considered on case-by-case basis. So what I tell someone else might be different from what you could get. Therefore, it is your responsibility to write out in the application form what makes you eligible to apply. So, for instance, if you've been working as a program manager, you could say at this level, I was managing this health condition, or I mean project, health related project, or this intervention or that. It's just about you tailoring your application to suit that specific condition or criteria that they have put out there. You could have a read about what band 6 means in NHS. So it's something you need to read about and see how it equates with what you're already doing. So if you're convinced that, yes, I've got that qualification, I have worked 4 years in population health arena, and 2 out of that has been at the level of band 6 and above, you should go ahead and apply. Go ahead and apply. and don't be afraid. So I want to conclude by saying that in your application, whatever you write is what you're going to be judged on. So you could have two people who have the same qualification, who have the same CV, but the other candidate has written so well about what they are doing, and the other candidate hasn't written so well. The recruiters are not going to know from their head without you telling them what your eligibility, that you have met the eligibility criteria. So in the application, take out time to fill everything. Fill everything. Some people would look at the optional pages and say this is optional. They won't write it. I will encourage you to write everything. Fill everything as it's supposed to be. Don't leave anything to chance, because they are going to combine everything that you have written and provide you with whether you qualify to be moved to the next stage. So I wish you the best if you're applying for the public health training for the next round of the cycle. I wish you the best. If you want bespoke sort of mentoring and mentorship for your application, you can join my mentorship platform. I will put that on the description below, and I hope that it helps you to prepare very well. So you can drop your questions on the comment section, and I will try my best to respond as soon as I can. But before our next video, I would say goodbye to you now and see you in our subsequent videos. Bye.